Results from a University of Cape Town research show alarming vaping trends amongst matriculants in some schools in South Africa. The study recommends the speedy implementation of vaping regulations. Let's chat a bit about this and what kind of regulations should be implemented to curb this problem. We're joined now by Dr Lynn Moeng-Mahlangu, the Chief Director for Health Promotion at the National Department of Health. Doc, thank you so much for joining us this morning. We appreciate it. I think for a couple of years now, we've seen how, popular vaping has become. And it seems that it's increasingly popular now amongst matriculants. First of all, talk to us a bit about what this study has found and what is the extent of the challenge that we're dealing with now.
I think the study which was conducted, and I was hoping that Professor Smith would be joining us today, Fansale Smith. The study is just an indication of what we have all been observing, that there is an increase in the use of these different products, which are now called the new generation products, which are your e-cigarettes, your vaping, your hunga, all those that are used, especially by youth, although the industry is saying they are marketed for people who want to stop smoking. We are seeing them being used more by youth. And although the study was only conducted in Cape Town, for us, it's supporting what has been observed in other countries as well. So it's evidence that is relevant to the regulation that we are now about to pass, to the bill that we are now about to pass.
And I mean, what kind of legislation are we looking at here? I recall a time when smoking was allowed in public areas, and then that was stopped, of course. And but now you have vaping that takes place anywhere and everywhere. There doesn't seem to be some kind of restrictions. Is there anything to be concerned about? I recall at the time it had been outlawed to smoke in areas that were not designated. There were concerns about the secondary smoke, that would...
Yes.
Are these the concerns that should be had with vaping and all these other new technologies, I guess, that are being used? What is the concern?
Precisely. The new generation products, as you can see, then some of them have actually showing invisible smoke that you don't see. Some are visible. And we are now saying, and they are not regulated currently in the country at all. So anyone can sell them, anyone can use them anywhere. So the current act, the current bill, it's saying we are regulating these products now, all of them, including the gadgets that are used for the product. So that's the first issue. Secondly, the marketing thereof will be restricted, will be limited similarly to the tobacco products. Thirdly, where they are used, who can use them, how they are sold, how they are labeled, all those are covered in the new act. The age restriction is also covered. It's actually scary that the more we delay, the longer the products are actually being used and spreading everywhere. Yes, the UCT product, a study is showing in high schools. We are aware that in most of the university tertiary institutions, and people, unfortunately, the young people don't understand the dangers, which is what we are trying to highlight. We had a few webinars where we're trying to highlight to them that these affect your brain. There are cases where we know that they affect your heart. So we don't know what's in the product. Some have nicotine, some have no nicotine, but even those that do not have nicotine have substances in them. The chemicals that are used, the colorants, are just as dangerous. So we are trying to address that gap with this bill.
Doc, does this include Hubley? Hubley is something that you would see at many of these, trendy spots. This Hubley is almost served as part of whatever is being consumed at that particular table.
It does include Hubleys as well. Some of them are using a charcoal that is banned. We don't know what are the other ingredients in the other Hubley. They add various substances. So we are regulating the nicotine products and the non-nicotine products equally. Because most of them actually have nicotine. They ban nicotine in different forms. Some add other substances as well. So even the hubbly-bubblies will not be used freely at the moment. One of the challenges is that in some of these vaping shops, you are actually asked to test the product before you can even buy it. It means you are introduced into it even before you can make a decision whether you are buying it or not. So the bill covers all those products.
You know, is one less harmful than the other? You know, I know you say that in some of these products, we don't even know what is in there. But I don't think young people understand that, you know. You'd be driving behind someone, you'd see this, you know, plumes of smoke coming out
Big
of...
smoke,
yes.
yes.
I think at some point I even thought...
It's exciting when you look at it.
I thought there was a car on fire, and then when I looked a bit closer, and I thought, oh, okay, there's clearly something else happening in this vehicle. I mean, let's be educative as well in some of these aspects. Is it, is one less harmful than the other? How can people protect themselves, you know, because obviously, you know, the issue of vaping was an issue where you heard a lot about if you want to quit smoking, vape instead, and you'd be successful in that journey. But it doesn't seem to be that case from what you were saying.
Definitely not. And also, if you look at where the vape shops are situated, they are situated closest to where young people can buy.
Yeah.
So you were asking a question, are there products that are much safer? I would say no, because our bodies react differently to different things. So I may take half a glass of whatever poison in my body and respond differently to someone who has taken liters thereof. So truly we would not, including nicotine, how much nicotine is safe? Nicotine is an addictive substance. So if you are introducing such products to young people, you are creating your consumers, your customers for life. From age 16 onwards, you know this person will be dependent and will move from one product to another. And even though they are marketed to be cessation products, most of the customers, there was a study that was actually saying 97% of those that are using the products, that are smoking and using the products, so it's a dual use kind of things. So it's not, there are some who may eventually stop, but at a public health level, we are seeing that it's a dual use product. So it is not helping us achieve our goal. And whilst we are saying they're helping people to stop, we are seeing an increase in smokers, whilst we are also seeing an increase in the product. So it's not like one is replacing the other. And that is the challenge.
I mean, can we expect to see some signs coming up? You know, it's quite clear in malls and wherever you go, no smoking here. You'd be shown to a designated area to smoke. I guess part of that signage now needs to include that would include vaping and everything else, because I guess, you know, the consumer who is sitting there could perhaps argue that there's no proper signage suggesting that vaping is also excluded from being, you know, smoked in these particular areas.
There will definitely be signage that covers both. Then I also want to highlight that at the moment, our current act is talking about 25% area, designated area for smoking. The new bill is saying there will be no designated area indoors and in some outdoor areas. And that includes both vaping and smoking. Because at the end, when you look at the definition that we have put in the current bill of smoking, it's more, it includes the inhaling, exhaling, all those issues that were not covered previously, because previously we were only covering products that were ignited. So now we're talking about products that are also not ignited to be included in the smoke definition.
And I guess the penalties
so the
also...
signs will definitely be there.
And I guess the penalty as well, no problem, Doctor, you know, the penalties for those who do not comply, in this instance? Does the Act speak perhaps to the strengthening of that? Because you still get very few areas. I think generally there has been great compliance. I guess from my own assessment, if I'd go to a mall, you would not be confronted with someone blowing smoke in your face. But,
Yes.
what are the penalties for those who don't comply?
The penalties, we have penalties for individuals. We also have penalties for premises where the owners of the premises are not complying. So firstly, as the owner of the premise, you must put signage, enough signage. Then secondly, if then you have an individual who would be smoking in enclosed spaces and ignoring the signage, the penalties could be not exceeding 3 months for those individuals.
Yeah.
But then you go to persons who are in control of places, it may be up to 6 months. Then we also have additional signages penalties where you are taking care of children,
Yeah.
or driving in a car that has children, or in a domestic environment where you are catering for children or domestic workers, also to avoid the secondary smoking. Those penalties can go up to 5 years imprisonment or even a fine. So we have those penalties going actually even up to 20 years, especially for manufacturers and importers. So there is a lot of focus on the owner of the premises, but individuals as well will be fine. The advantage with these regulations, the Act itself, it's so self-regulatory that people will report you. That we are seeing that at such and such a place there is this happening, and then we can act on that. It will not be possible to have individuals, inspectors going from household to household.
Yeah.
But if a domestic worker is reporting an act, then we can immediately act on it, unlike if we are not regulating that at all.
Doctor, we really appreciate your time.
That addresses you.
Oh, absolutely. Thank you very much indeed. Lots of educational aspects on that. We really do appreciate you, giving us further details on that. Dr. Lynn Moeng-Mahlangu, the Chief Director for Health Promotion at the National Department of Health.